Hi, my name is Nicole Baez. Today is November 15th, 2020, and this is lab number 2, the sheep heart dissection. This is the back of my paper. The other paper I will be referring to is this one over here, and this just lists the directions and every structure I'll need to be talking about. And this is the back of the paper. Let's see. That is the direction. So if I'm looking down in that direction, that's what I'm looking at. So here is the heart here. This is the right side of the heart and the left side. Outside here is the epicardium. Inside is the myocardium. And inside is the endocardium. Right here is the interventricular septum, and this here is papillary muscle in here. You can see it right there and right there. It is not the strings, it is behind it. So deoxygenated blood flows into the heart from the inferior and superior vena cava. I will find it right here. This is the superior and the inferior vena cava, then flows into the right atrium, which is right here. This is the right atrium, and it flows past the tricuspid valve, and which is right here. And underneath the tricuspid valve are chordae tendineae, which are these string-like structures. They are called the heartstrings, and they are right underneath the tricuspid valve. So the blood flows past the tricuspid valve into the right ventricle. From the right ventricle, it flows into the pulmonary artery away from the heart. And that is, here is the pulmonary artery. So this is also the right ventricle, just the anterior side of the heart. So here is the right ventricle right here. So we can see the blood flows from the right ventricle into the pulmonary artery up here. So from the pulmonary artery, deoxygenated blood flows into the lungs, becomes oxygenated blood, and flows back into the heart, into the pulmonary vein, which is right back here. From the pulmonary vein, the blood flows into the right atrium, which is right up here in this area. This is the right atrium, flows past the bicuspid valve, and underneath the bicuspid valve are the chordae tendineae, and into the right atrium, the left ventricle here, and from the left ventricle flows through the aortic semilunar valve, which is right here. Up here is the aortic semilunar valve, and all the valves in the heart prevent backflow. This is the aortic semilunar valve, and from here flows into the aorta. And so the blood flows, the oxygenated blood flows through the aorta and supplies the rest of the body with oxygenated blood. I don't know if I missed anything, but I'll just repeat really quickly. This is the interventricular septum, and this is the papillary muscle. And that is it for the heart. Next, I will be talking about a disease of the heart known as the coronary artery disease. Coronary artery disease results from a decreased amount of blood flow to the myocardium of the heart. When blood flow is decreased but not stopped completely, it will cause chest pain and trouble breathing due to a decreased amount of oxygen to the heart muscle. When blood flow is stopped completely, this will cause myocardial infarction. This disease is caused by atherosclerosis, which is the buildup of cholesterol plaque and inflammatory cells that build up along the inner perimeter of the coronary artery, and when it builds up, it creates a texture that allows for thrombosis or clots to form, which will prevent blood flow over time. A common predisposing factor for this disease is if it happens to run in your family, and other factors that can cause this are cigarette smoking, diabetes, and high blood pressure. When this disease becomes life-threatening, a surgery can be performed called coronary artery bypass surgery. And so that is a step that can be taken if it becomes life-threatening. That concludes my presentation. Thank you very much.